I know you are young at the age of 35. It's, probably a little bit brutal to say, but at 35, your fertility start dropping down. You need to be aware of this.
When are you going to have kids? There's a question that nobody asked for. And whether or not the answer to that question is yes, it is often not an easy journey. Around 1 in 7 couples in the UK have difficulties when it comes to conceiving. That is around 3.5 million people that may need fertility treatment. In this episode of the Lifestyle Prescription on Pharmacy Planet, we are going to be looking at what couples should know when they are facing unexplained infertility. We're going to be looking at what women need to know before they go on an IVF journey, how to navigate treatment while also balancing work, and we are going to be debunking some common fertility myths. I'm Rena Annobil, and my guest in the studio is Dr. Marianne Vendola, who is a leading expert in women's reproductive health. So whether you are on your own fertility journey, whether you're supporting somebody who's going through it, or whether you just want to know more about this growing area of women's health, then this episode is for you. Let's get into it. Dr. Marianne.
Thank you, Rina, for having me here today.
Well, thank you so much for coming in. It's really lovely to have you here. So much to talk about in this episode. Right. So just want to say that, after years of women hearing, don't get pregnant, that's not what to do. Now there are a growing number of women who are quite anxious about their fertility. Break it down for us, right? When does fertility start to become something that women should worry about? And when does it start to decline?
Absolutely true, Rina. We've been for so long now talking about how to prevent for women to get pregnant. And now we're actually struggling to get them pregnant when they want to.
Yeah.
So first of all, I appreciate that we all know, HFEA has demonstrated and brought out data that there is a shifting in maternal age from when a woman now is ready to get pregnant. And we're talking about starting thinking about it and approaching fertility treatment around the age of 35. But to be completely fair, the peak of our fertility ends towards the 32, believe it.
Ends towards 32?
That's the peak that we have before the 32. So 24, 25 until 32, that's the peak of our fertility. So it means that when we get to the 35, we are starting to having a decrease in our fertility. And I'm not saying, and I'm not absolutely implying the fact that if you want to get pregnant naturally at 35, you cannot, obviously. But if we're asking me the fertility for a woman, and this is measured in different ways. One of the way is measuring, for example, approaching, knowing about your health, your ovarian health. And we have different tools to do it. Some blood tests, we have some ultrasound that help us indicating where we are. Okay. So these tools that we use after the age of 35 demonstrate us that we have started our decline. Okay. And this is not just in terms of numbers, this is in terms of quality. So when we talk about women below the age of 35, the quality, you need to consider that when we talk about quality for women is in terms, for at least a fertility point of view, talking about the chance that you would have to create a healthy child. So not affected from chromosomal condition that can effectively create risk of not getting pregnant or miscarriages, because that's what we get through when we get older, isn't it? So if we judge the quality based on this tool, we know that below the age of 35, likelihood of having chromosomal condition is around 15-20%, okay? But that increases from 35 to 40. And we go from the 20% to double it at the age of 40, almost 50%. Wow. Of your fertility is compromised. You see what's the gap and how is difficult for women who are not informed and sort of approach fertility a little bit later on with all the hopes up of of course, this is a a necessity that as a woman we have, an unconditional necessity, okay, to have a child.
Well, if people want to have a child, obviously, then it's like there is this thing, right, where it's very difficult to find that perfect time for a woman, right? Because, you know, as you know, there's so much pressure on, like, you've got to do this in life, you've got to be sufficient. I was brought up in an era where it was like we were singing the lyrics to Destiny's Child, independent woman. We've got to have this, we've got to have our own house, we've got to have a
100%.
job, and then you're going to think about kids, right? And then when that time happened, a lot of people were mid-30s already. I know that younger people now are thinking about fertility a little bit earlier, aren't they?
And this is exactly why we want to spread the voice to women. Please try to be aware of your fertility at any point you are. Okay, I'm pro about being in control of yourself. So at any age, if you are at 30, if you are at 35, 40, 50 as well, we'll probably touch about that. But it's important you are aware about your fertility. And now women are getting more aware about that. And if you're not ready for a pregnancy just at the beginning of your career, which, as you mentioned, it is the case and a lot of the time for a lot of women, well, there are plan B. You can consider to freeze your eggs. You can consider
Yes.
to freeze and share your eggs if you also want to do something to help others. There are different possibilities that we open and we should be open to. And I think more and more women now are actually approaching, young women are approaching this view of considering the plan B. It doesn't necessarily have to be a plan A. You can always approach natural conception, but that is your plan B if you reach the age of over 35, 40 and you still want to consider a family.
Right. Now, I was going to get onto this later on, but we should talk about it now because you've mentioned it. Egg freezing, right? And having that choice and people thinking about it now. Why would people egg freeze? Is it because they want to freeze the healthy eggs and then have them put back into the like, how does it work? Do you know what I mean? I think it's at a bit of a
No, absolutely. We
funny
need
area.
to clarify for everyone because actually it is relatively new. I mean, HFA started collecting their data from 2010 approximately, and there were 300 cases, and we exploded from 200 in our practice to 2000. Can you imagine how it has
Yes,
increased
yes,
over the
yes.
last 15 years, and particularly I have to say after COVID? So what happened? Why would you freeze your eggs? The reason is because, again, as you exactly mentioned, women are more involved in their life, in their career, and not ready to set up a family in the latest 20s or early 30s. So what you can do, and you say, actually, I'm going to collect my eggs possibly in an age that is younger than 35, possibly, because for the reason I told you, you would get actually better quality of your eggs and you probably will need less collection to build up the ideal number, at least to make sure you will have one live birth or more. And in this way, you can have your eggs in storage. Now the storage actually has changed. From 2022, it has to be allowed over 55 years. So you have plenty of time in your life to decide to thaw your eggs at any point, and they will be fertilized. And then again, and now we have women that found their man later on in life, or we got women they might not have found their man, and they need to use donor sperm because they waited and didn't actually quite get there. But I think fertility, by all means, should be open to everyone. And that is when, exactly with a partner or with the use of a donor sperm, they can create embryos.
Sure.
And that embryos then, it will be transferred. So you transfer
When you want
that
to.
embryo when you want to. And whatever embryo has been left, you can have it in storage as a backup, as a future plans, as a siblings.
Right. Is this expensive? Can people get it on the NHS?
So NHS, unfortunately, has been stretched to the limit
Yes.
over the last years, especially after COVID. Especially in UK, there's a sort of, and London, there is a sort of lottery actually of a postcode, and depending where you are, you can get more access to some fertility treatments or not, and that maybe the number of cycles you can get are
Mm-hmm.
more or less. So it is actually quite a struggle for NHS to being able to offer fertility treatment. This is why the private sector has had honestly a peak after, I was
Mm-hmm.
saying, after the COVID, because of course they needed treatment. They started thinking that that was the time to do it, and of course NHS cannot help too much on that, and this is why again the private sector gets to help. But honestly, doesn't this happen in, in any other sector? What do you do if you
Right.
have any
So
other, problem? Wouldn't you go private because you want to go quicker? It's the same thing.
what is the cost that they would be looking at to go down the egg freezing route? Are we talking like how many thousands and approximately?
It can go from 5,000 to 10,000 as I said. It depends the cycles you do, depends where do you do it.
Right.
There are also some finance helps and aids
Mm-hmm.
that a lot of these third parties,
Yeah.
that because now you know that the healthcare is not as in US, but definitely we are getting more these third parties companies that get in the middle between the patient and the company itself to try to provide
Sure.
finance options.
Mm-hmm.
So that is the way that now we are approaching, and patients are approaching a lot of the finance side of this. So approaching these third parties companies that actually provide the finance to make it
Yeah.
more approachable. So there
Okay.
are these
So there are
a lot of
options. There are
there
options.
are these
Right.
options.
That's fine, because I just wanted to give people who are watching, if that's something that they wanted to do, so they know, okay, you
We
know what,
do work
this
with
is what
third
I'm looking.
parties, and a lot of clinics definitely they do work with these third parties companies that can help the
Help.
patient in that respect.
Sure.
Absolutely. They are present in IVF, they are present in egg freezing, they are present quite in a strong way. They also offer a lot of the time reimbursement or fee if something doesn't go as it should. There are different companies that work in a slightly different ways. They have different
Sure.
packages, but they definitely, I think it is becoming a little bit more approachable compared to before, because of this
Sure.
third parties company that are getting into the health system.
Mm-hmm.
So and also because again, maybe we are not, as I said, at the level of US, because in US there is a private health care. So if you work for whichever company, you
Yeah.
will get paid, and very likely they will also cover fertility treatment, because that's the, like Google does
Sure.
it. There are some pharmaceutical companies that do it. But you see, all these companies, these are companies that work abroad and work with the employees traveling, so they need to cover them anyway. In UK, if you are a small company and based in UK, where people and your employees do not travel, we still have the NHS, so it would be the National Health center that would take care. So it's more difficult that we will approach for everyone the idea of providing healthcare and help in fertility for women to everyone, because we work slightly in a different way.
So, Dr. Marianne, I want to just talk a little bit about what you said about the quality of the eggs and fertility declining. Are there any lifestyle things that have an impact on this, either that accelerate that decline in fertility, or stuff that women can do to naturally boost their fertility?
It's a very interesting question. So fertility is influenced, as I would say, probably anything in our health, from the environment we live. So 100% what we eat and the way we take care of our body, it makes a difference. If you smoke, if you're healthy, if you're overweight, these things affect fertility. So the healthier you are in especially taking care of your BMI, of your body weight. I know a lot of women, actually, unfortunately, for different reasons, for style of life, because they're always out and everything, let themselves a little bit behind on this, but it is very important. Having a body weight that is overweight and really high, it does affect fertility. It really does. It does affect the response of the medication you get. So yes, smoking tremendously. Of course, now I think in UK we are actually far much better than rest of Europe. So we're doing a very good job on that. But still, the vaping is still very much there.
Okay.
So that also affects. So what we eat. Yes, I think what we eat is important. But again, if you do everything with good sense and balance, and your weight doesn't become too much, then it's pretty much in a good sense everything is fine. But it's when your body mass index get actually
Sure.
affected,
Right.
that fertility can get compromised, and also the way you would respond, as I said, to medications. It would.
Are there things that you would recommend to couples who are trying to conceive naturally, natural things that they can do, supplements perhaps, or lifestyle choices to increase their chances of conceiving naturally?
So there are supplements, definitely there are good supplements that are out that you can use. Absolutely. We do use some of them, especially for couples that approach fertility. Yes, indeed. But as I said, keep being healthy, and to be fair, that's as much. In terms of what I would say to young people is, be aware of your fertility and don't give it for granted. There is not just a shift in the maternal age of approaching fertility, but there's a shift in paternal age. The male factor occupies a good percentage, if not 30% or more, of the sub-infertility problems we have. So the fact that they're thinking that it's only the woman that carries a problem because the sperm, there is a spermiogenesis in 3 months, and then, everything gets new, and then, of course, they're going to be fine, and they're going to be fine for longer. That's not totally true, in the sense that young men do have problems at the point that they need to approach IVF because they're not getting their partner pregnant. And a lot of the time, it's a combination of factors. It's not just the woman. And this is why we always try to go, in a very mild approach. We start from, if it's possible, start with insemination, more a natural approach, ovulation induction, and then before we get to IVF. But on the other side, I would say, do not persevere in something that you are seeing is not successful, because I see a lot of patients reaching the IVF after so many cycles or so many years of trying, and you lost your time.
The time, yes.
You lost your time. I appreciate that, again, this is an unconditional need that a woman has, and therefore they're really trying and are keen to succeed because they feel themselves young and they feel that they want to achieve it. But be always aware, if you are not getting there, then ask for help. The sooner the better.
So how long would you recommend that couples try naturally for? How long is too long?
Rena,
in terms of
depends on the
wasting time,
age. Rena, depends on the age. Because, of course, if you are around the age of 35, yes, of course, you can take a little bit more time, 1 year. If you are 32, take 2 years. But if you are 40, oh my God, yes, take 1 year if, that puts your mind in peace. But after that, maybe you need to approach to different fertility treatment, and you need to say, it's going to be my child, even if I use donor eggs. There's a lot of me to the baby after the age of 40 if I use donor eggs, that even if it's not my personal genetic. There is the epigenetic that is a science. It's true. Your baby in your womb will be yours. It will be what the environment on your uterus will pass to the baby.
Right.
So it is your baby. And if you carry it or I will carry it, will be different. So at one point, give yourself a year. It doesn't happen. You can't just keep continuing, because then what you're going to do, you're going to spend 3-4 years and then you're going to approach fertility treatment with donor eggs. Is that, did that put you in a better position?
Listen, Dr. Marianne, it's so difficult for women. We know that it's so difficult getting yourself on track to reach your goals, finding the right person, and then starting this journey. And the earlier, the better it's supposed to be, right? However, if couples, that's something for another podcast, right? But if couples have been trying for a while, right, and they it's not working for them, what then are the first steps that they can take? Because you did mention that it's not only just going to IVF straight away, that you can regulate ovulation and things like that.
Absolutely. If we're talking about young couples, yes, maybe one good thing not to waste time would be, if anything happens, you're young, 32, 33, 34, whatever, and you're trying 6 months, 8 months, nothing happens before even you reach the year. Why don't you have a look of your tubes? Are they open? Is it still happening? Ovulation, is it happening? And why don't you test the sperm? Is it normal? So you can do this without waiting.
Is this a private test that people should do and can do?
So again, some GPs are more helpful, I would say, and they would actually do something about it. Some, because again, sometimes they see that as a sort of personal problem, and they probably are a little bit more sensitive, but some other time they just don't do it. So you have to actually approach privately if you want to do some of this test. Look at the AMH for a woman. If you want to test your fertility and you want to know where you are in your life, and even being able to decide to do anything with that information, the GP or NHS won't help you. You need to go private and take your test.
Sure. Okay.
So not always. No.
Okay. Right. So are there times when there is sometimes unexplained fertility where everything looks fine, both the man and the woman are healthy, and it just doesn't happen? And then what is the next scenario? What is the next steps?
100%. There are patients that approach IVF even if they are young, because there is a problem of subinfertility, unexplained fertility. Unexplained, it doesn't mean that you don't have the problem. You have it because you've been trying 1, 2 or more years, and you're young and you haven't got pregnant, and maybe your ovarian reserve is good. Theoretically, the quality of your egg should be good, and the sperm is normal. Where is the issue? Of course, there are things, and the genetic tests help us a lot in this, because there are karyotyping that can rule out if there is any underlying genetic condition behind the man or the woman, because we can genetically test the embryos that we create. So this is why at the end, reaching IVF for these patients that are young with subinfertility and unexplained infertility is the gold standard. Because we manage to get results with IVF with the use of these tools, genetic tools,
right? A
lot of the time.
What do couples need to know before starting an IVF journey?
So I think that, as I said, a lot of the time, especially we're talking about younger, because IVF, it can be done at different ages, okay? And with different techniques, your eggs, donor eggs, so you can approach fertility IVF at 50, let's be clear. So if you are young and you are considering...
And if you want your own egg, because I think a lot of people want it to be, their egg, their partner's sperm, ideally in a scenario where it's like a heterosexual couple, that is the ideal scenario. So let's start with that situation.
Absolutely. So I think when you're younger, a lot of the time you think that because you're younger, this is going to come easier. And unfortunately, I have to say that it doesn't. It's not necessarily because you're young it comes easy, because especially when it's not clear the reason and where it does comes from, we can create embryos and sometimes we try to implant them and it doesn't work.
Okay.
And this is why I was saying in a lot of the time now the genetic test give us a help. It's not 100%, but it is a big help. We have tools that can help us. We need to use them.
Sure.
So I would say to the young couple is try, probably start looking into this if you can see that there is a problem. Ask for help, the sooner the better.
Mm-hmm.
And then if you're young, again, you can create embryos with the help of the genetic test. You can save embryos in storage for future use. And that would be ideally the quickest, the easiest, and the less grief for couples. But in reality is also a financial journey. A lot of the time young couple can't afford to do fertility treatment with genetic testing. Is a lot to take, and therefore they reach stage by stage every time, and that is a dragging of a problem, and then you need to add money at the end every time. It's not easy. I appreciate that it's definitely not easy, but I would say to them, put in your mind, this is a journey. This is a journey. Don't give anything for granted. It's not because you're young is necessarily going to come. And this is science. I say this to all my patients. This is science. 2 + 2 doesn't make 4. It can unexpectedly make 6, okay? But it can make 1. So don't try to set your expectations, okay? That's what I would say to the young people. Because even if you're young, it might be not that easy.
So from what you're saying is when we think about, like, as women, things like career goals, what we want our life to be like, we do need to quite early on have that thing in our mind. Do we want kids as part of our life plan or not? And be quite serious about that.
And I would say more, Rena, be open. If I say to my daughter now, she's talking about, she's 18, thinking about the future and working in embassy and international relations. She said, no, I'm not sure I want a child. Of course they're not. You are in your 20s. Why do you even want to think about that? Okay. So I appreciate that. But when you reach towards your 30s, and this is why I told you before, 30 I think is a very important age for a woman. 30, then I think you should have a little bit more an open mind to say, what if I want to change my mind?
Sure.
Because that is the thing. What if you will change your mind? And you say, I don't want it now, but what if? Maybe if I want it later. So leave that door open. Again, egg freezing, egg sharing. There are ways that now you can do it. Leave your door open.
What are the realistic timelines for IVF for a couple who are just about to go down that route of IVF? How does it all work and how long is the process?
The process, it can be very long, as I said before. If you are starting and using fertility treatments that are not your best option. And they can be cut a little bit shorter if you pick up the option that is the best for you. Now, that is, as you said before, where as a women we struggle. I'll give you an example. You come at the age of 43, you are in the second part of your life, second partner, and you want to consider a child, or other way around. You had a very easy, pregnancy, the first one, you wait a little bit longer, now you're considering another pregnancy later on after 40. And you come to me, your ovarian reserve is reduced, and I say, well, actually, this is the point. 43 years old, I would start considering donor eggs. And that's where we struggle. And we say, well, actually... You struggle
because what, people don't want to do it? Or there aren't that many of them?
They do want to have a child with their own eggs.
Okay.
And therefore, it's more of a struggle, the acceptance of fertility treatment that would be potentially more successful, getting the results quicker, compared to keep trying with yours for a couple of years and you might be successful, but you might likely even know. So that is when, again, I would say that it's really depending how long you're going to make your journey.
Right. Okay.
It has a psychological impact. In a way, you are deciding how long you're going to make your journey, because in this respect, we are maybe sometimes a bit brutal. I appreciate that, but I think a lot of the time, speak personally, but I'm quite fair. And if there is a chance, I will fight with you. Until there is a chance, I will fight with you. But when I think that is not your best option, I will tell you this is not your best option. And if you still want to pursue with that, and I can tell you that I have thousands of patients that we share with colleagues that have this issue. They still want to pursue with what they think is their best. And this makes fertility treatment really long, really long.
Okay. So if somebody has then accepted, okay, well, either they use their own eggs if they can, or they use donor eggs, what are then the steps in terms of IVF, like preparing your body for it? I've heard of people going to work and like, they have to inject themselves with hormones in the toilets and this kind of thing. So what do they have to do to prepare themselves for that embryo to be put into them?
So again, the approach is quite different, because if you do infertility treatment with your own eggs and you need to stimulate your ovaries, or if you do egg freezing, same thing, or if you donate in your eggs, again, it's a stimulation of your own eggs. So you have to use injections that are done for 10 to 12 days approximately. You have to do it every day. It can be 1, 2, or 3 injections. So it's quite, for 10, 12 days. It's quite intense. Okay, it's not an easy thing.
And can you carry on with normal life at this point, or should you be taking it easy to help yourself?
Reality is that the majority of women just carry on with their life. They do it what they keep doing. It's very unlikely that a woman, especially as you say, we're talking about women that work. We're not talking women that are home or going to the gym in the morning. These are women that are most of the time in career. Yes, they go to work. They have to inject in the bathroom. They need to inject anywhere that is possible, because they have to get on with their life. So does the stress impact? Yes, impact. Of course, anything impact. But we all live in this reality. So it's like saying, oh, should we breathe a better air? Probably, but that's what we got.
Okay.
So yes, they do
so
it.
it is stressful,
and it's not easy.
but you can do it, right?
They do it. The majority of women, they do it. So yes.
So they're injecting themselves several times a day.
Yep.
What was it, with hormones to stimulate egg production?
Exactly.
Right.
So the way it works is that our pituitary gland essentially release hormones that tells the ovaries to produce estrogen, and these estrogen get to mature, because otherwise every month we will have only one follicle, one egg mature, the majority of them possibly. Okay. So you need hormones that actually make this happen. So you need to release this hormone for 10 to 12 days before effectively you are ready. And then you get your trigger injection, which is the one that makes the follicle mature, ready to be taken. Once they are taken out with the egg collection, then you can fertilize them, or can put them in storage, of course. And then after they fertilize, this is what I was telling you before, then you can test the embryos, because after 5-6 days, sometimes you reach the stage of an embryo that it can be tested. And at that point, you get information about the karyotyping, about the chromosome of the embryos. Sure. And that is something that is a tool that we are using more and more to get more successful and try to get a better, what we call the blessed live birth rate, which means a baby. Okay. Ongoing pregnancy, we should say, probably, because that would be more fair, but that's the genetic tool that help us in that direction. Okay, it's not 100%, but it definitely improves our life.
And so you know that the embryos that then you are placing into the womb of a woman are healthy with this screening. or from like
Consider,
mostly help?
yeah, 100%. So what it happens, at least what HFEA has made very, very clear, is that the tool that we use as a PG testing is a tool that has has lowered the chance of miscarriage for aneuploidy. And that is accepted. Okay, so we finally accepted that. HFEA has given a green light about it. So we can reduce the risk of miscarriage for aneuploidy. So it means that in somehow it better and our chance of a healthy pregnancy. Does it goes from 30, 40, 50% to 90%? No, it mostly goes to 65%. But I would say that as good as it gets.
Sure. Okay.
So it does improve.
Dr. Marianne, are there some cases where IVF just doesn't work for people?
As I said, the answer is yes. Unfortunately, yes, the case where it doesn't work, but again, are we talking about it doesn't work because you're not using your own eggs? You want to use your own eggs, you tried everything and it didn't work. But then we have a further step. Then you can use donor eggs. Is it that stage you're talking about? Because again, there are different stages of things that you can do, you can approach.
Right.
So sometimes, yes, it didn't work using your own eggs. But did you try donor eggs? Even that didn't work? Because I think that you need to consider all the stages before you say it didn't work.
So there's your own eggs, right? There's your own eggs and your partner's sperm, or a sperm donor, if that's the route that you're taking, right? Then there's donor eggs.
Yeah.
Okay. Now, is there then a point where that may not work? And is that just a case of a woman's body cannot hold the baby? Is that a possibility for people? Is that some people's reality then?
Absolutely, Rina. You need to consider that we haven't touched the fact that there are women that have, since they're young or later on in life, problem has fibroids, endometriosis, big impact, adenomyosis. These are all, again, benign. We're talking about also always in the benign aspect of the uterine pathologist. But yes, they create a big obstacle. You can, again, I haven't touched that in particular because it's really a big chapter, but of course, you do have women that would struggle from a structural problem that they have. And in that case, sometimes even using donor eggs, it can't be part of the game. And then you need to talk about surrogacy. But this is a chapter per se, I would say. If we're talking about women that are in a healthy environment of the uterus or minimum impact of fibroids or minimum impact of the endometriosis, which could be.
Then PCOS is another one.
PCOS would create you a problem earlier. Not at this stage, but it would create you a problem more to get pregnant naturally. Women with PCOS, and that again, we're touching very different scenarios. Women with PCO are very likely young women. It's a dysmetabolic problem. Okay, so PCO is not just a problem of the ovaries. There's a problem on your androgens level. There's a big problem behind. And normally this happens when you're young. When you're later in age, it's the other way around. Our androgens as women, after 40, they drops down. So you have different scenarios there. So this is a problem to get pregnant naturally. And some they will still make it to get pregnant naturally with PCO. There are a lot of help that we can give on that. I believe that absolutely. But some others, they will still have to go IVF, and it's not easy to approach when you need to stimulate that ovary with that level of high androgens. No, it's never easy when you have a problem underlying, apart from, again, the ovarian health.
Coming back to IVF and women in the workplace leading a normal life, getting on with this, getting on with the IVF journey, is there more that workplaces can do to support women on this journey? And do you think that more women should actually be talking to their employers about this? Because it's hidden a lot of the time, isn't it?
It's very much hidden, absolutely. Women sort of feel shame almost
Yeah.
of having to ask help, and I don't think that should be. But this is again since over the years that we had to fight for our rights, and we always had to add layers of stress until we got there, and probably will take a little bit longer time. There are companies there are very good companies. I know some of them. They do provide the fertility treatment for employees, as they provide, as I was mentioning before, healthcare. Healthcare cover. So because a lot of the time the two things go together. So if a company would provide a healthcare, then they would be looking into also for their employee to consider the fertility. But if they don't provide that, then it's very difficult that they will cover the choice of a child, especially if it's a small company. You need to think about that.
I mean, that's understandable, but even just letting your employer know that you are trying and you're going to start this, I think that is a big deal, and I think a lot of women probably think that they're going to miss out on promotions and this kind of thing because maybe their employers think that their mind is on something else. But then it's a very normal thing to want to have a family, right?
We honestly, Rena, I don't think we will ever get the hang of it, because it will always be like that. And women can be super women and try to be mothers and carers and women working. But the reality is that if you work for whichever company, the company will always take the look that you are a woman, and sooner or later you will take some time out because you want to build up your family. And are they gonna like this? I don't think they will ever gonna like it. They will have to gobble it probably, and will make it hard for them. But I don't think that it will come, as easy. We will have to fight for that.
Listen, this makes me really upset and angry because then people are like, oh, the birth rate is declining. We haven't got enough people. You need new people, so let people make the new people. I really love the fact that you've broken down IVF and different choices that women can make when it comes to fertility. And I think that is so important to put that information out there so that women can think about it. There is a lot of information, though, out there on social media, isn't there, at the moment? Like, I just feel like it's exhausting, and particularly if you are a woman who is thinking about having a family, the algorithms are such that you'll be then flooded with all this information of people talking.
Very true.
Do you think that there is also misinformation that is spread online a lot of the time as well?
And then I can ask you the same thing. If I read a newspaper, do you think I get always the right information outside on how much is around? Yes, it is true. Absolutely. There's a lot of things that go around that are misleading. 100%. Like in any sort of media, any sort of things. You do some interviews and they're very realistic, they're really informative, but you need to know who you trust. I would go to BBC if I want to trust. I'm not sure I would go anywhere to get this information from. It's the same thing I say again to my kids. Where are you getting this information from? That is what is important. There is a lot around and not everything is true. So you need to really be sure of where you're getting your information from. But I will apply this at every level across.
Are there certain fertility myths that you would like to just clear up for people? Things like the misinformation thing and things that people think they should be doing when it comes to fertility and IVF.
I think that I have touched one before, and the fact that a lot of the time we as women take all the blame. And we think it's all because our eggs, it's all because our age. That is not true. Sorry guys, but a lot of the time the problem comes also from the man, and it's not a blame. It's just because we need to balance the two things. An embryo is 50-50. So it's not necessarily that is a problem that will come for the woman. You need to look at the male side as well. And you really need to look at even when you're young, because there is this misconception that, young men 30, 35 years old, they're absolutely fine. A lot of the time, they're not. So I think that this is the first myth. And then about information for women and their timing. I know you are young at the age of 35. It's, probably a little bit brutal to say, but at 35, your fertility start dropping down. You need to be aware of this. It's not because you're 35, then this, I'm young and everything is possible. Maybe.
Right. It's brutal, but yeah, people need to know. People need to know this.
People need to know. And again, another misconception is, I'm 30, I have all my life to think about it. You might have, you might not. If you don't test yourself, you wouldn't know. So around the age of 30, I think it's it's a relatively good timing before you're too young, you're too busy, having fun, which is fair. But around the age of 30, you should start considering looking and knowing yourself. Knowing. You don't need to do necessarily anything with that information if you don't want to, but know yourself. Okay. That is what I would say.
What about things that people think you should be doing or eating, or sex positions, for example, in order to increase fertility and to conceive
I wish there was,
quickly and naturally?
I wish there was, Rena. I don't think there is.
Right.
Although we do ask our patient after the IUI to lie back, but right. I'm afraid no in that. I told you before, I think with good sense, you can have a relatively happy life, enjoy your weekends out and have your glass of wine or beers for men. But then it can't be, on a regular basis. You need to balance your life. And again, having a good weight, it is the sort of a scale, right? Mm-hmm. So you measure yourself and you say, okay, if I go above this, I'm not doing something good for my life. And if it's not good for your health, it's not good for your health in fertility. It's the same principle because it will affect everything. Like the blood pressure does it, like the diabetes does it. They all do affect fertility. The thyroid function, they all do affect fertility.
So we can't get away from this. It's just good health in general and a holistic view at looking after yourself. 100%. There's no getting away from it, basically, 100%. When it comes to fertility as well.
100%. It's all part of the taking care of you. And I honestly use the scale as a bit of a measurement. If you can't do anything more about that, use that. Because when you see that this is going too much, that it means you're not taking care of yourself, and this will very likely affect you.
Okay. I want to just say thank you so much for, coming here and just breaking down sometimes the confusing and complicated fertility and IVF journey, breaking that down for people who are watching and listening. I want to just ask you, this is called the lifestyle prescription on Pharmacy Planet. And if there is one lifestyle prescription that you could give to all women, let's say, what would that be?
So I don't think it's a prescription, Rena, as such, but I think I would say be aware of yourself wherever you are, in whichever stage you are of your life. You're 30, you're 40, you're 50. Check yourself. Check where you are, because knowing yourself, knowing your ovarian health, again, I said before, your AMH, your ultrasound scan, do the basic things that make you aware, informed of where you are. And then with that information, you can do anything in your life because you got your own prescription, your knowledge, your self-empowerment of taking any decision. But you can take any decision if you are informed. If you're not informed, then you need to count on whatever it happens. So the prescription is be aware of yourself in whichever stage of your life. That's what I would say.
And if somebody is concerned about their fertility and maybe thinking, okay, now is the time for me to start thinking about IVF, where are the best places for them to get more information and treatment?
So I would say, as I said for you before, if I need to know any information, about reliable source, I would use BBC. So use probably HFEA is an incredible resource. You can get a lot of information through them. NHS absolutely offers it. Or if you want to refer private, look at big practice that they expose themselves providing their data, their competence, the people they work. And if you do trust the results, the people they work and everything, that is good enough to say, I would trust this group, I would trust HFEA, I would trust NHS.
Sure. Thank you so much for coming on.
My
it has
pleasure.
been, I feel like there's so much more we can talk about, but I really, really enjoyed our conversation.
Likewise.
And I hope that you have taken away something from this conversation as well, whether you are on your own fertility journey, whether you're supporting somebody who is on a fertility journey as well. I hope that it has been useful. Please do share this podcast with people that you know who might benefit from it. Show it some love, like, subscribe, all of that. Drop a comment down below, and I will catch you on the next one.